Welcome to part 2 of our lesson on the sociological imagination. So let's revisit our 3 objectives for this lesson. We have already spent a lot of time in our first mini lecture on the first objective, which was to describe the sociological imagination and use this imagination to interpret experiences, events, and issues. Now, these objectives are partially for me. They help me plan the lesson and be clear on what you should be able to do. But these learning outcomes are also for you. Whenever you see learning outcomes or goals like this written at the beginning of a lecture or at the beginning of a textbook or chapter, I suggest that you turn them into questions for yourself. So by the end of this lesson or by the end of this chapter, am I able to describe the sociological imagination? Am I able to use this imagination to interpret experiences, events, and issues? This helps you know what to focus on. So I invite you to use your sociological imagination in the following example. Our example is childbearing. How do you think a person decides to have a child or not? And how many children to have? What factors do you think make childbearing a personal or private decision and act, and a socially structured decision and act, what Mills would call a public issue? Let's look at a global comparison of childbearing rates for people who have uteruses and or people who have female assigned reproductive systems, or FARS, F-A-R-S for short. I use the term FARS here because it's more gender inclusive. After all, not all women have uteruses, but the vast majority of people who have children do. And so this is actually the most accurate term to use. Despite FARS being the most accurate term, most data up until this point has not been collected using this definition. And so the best information we have is based on the social category applied to people of women and men. This table shows the average number of births per woman in different countries around the world. And countries are color-coded. The deepest color blue represents an average number of 1 to 1.9 births per woman. And this goes all the way up to the deep orange color, which represents an average number of births of 6 and higher per woman. And we see here the lives of 2 individual people highlighted. On the left, we see Cindy Rucker, 29 years old, recently took time off from her job in the Toronto public school system to have her first child. On the right, we see, although she's only 28 years old, Baknizar Khan has 6 children, a common pattern in Afghanistan. So what are some factors at the national level that would shape the average number of births per woman? What are some global trends that you are seeing across countries? Using your sociological imagination, come up with at least 5 different patterns. Now let's revisit our learning goals. If you are easily able to draw upon your sociological imagination to analyze childbearing as a public issue, then you're on the right track. But there is more to this sociological imagination, specifically the intersection of biography and history. Mills writes that, quote, neither the life of an individual nor the history of a society can be understood without understanding both. So we can't make sense of individual people's biographies without understanding the society they were raised in and that they lived in, and how that society developed historically leading up to the moment of their life. And we can't understand how societies change without considering how individual people live their lives. What are 3 significant historical events that impacted the people who lived through them? Pick the first 3 that come to your mind. I can think of, for example, the Great Depression, sexual revolution, major developments in human rights legislation, 9/11, world wars, the creation of the World Wide Web, and more recently, COVID-19. And of course, the events we see as significant would differ around the world. So you might have completely different answers if you have grown up in different places. Sociologist Carl Mannheim has informed how social scientists think about the intersection of history and biography. Mannheim was a Hungarian sociologist who lived not only in Hungary but also Germany and Britain. He was in Germany in the tumultuous years in between World War I and World War II. In this time of tension and conflict, Mannheim noticed that different generations seemed to be interpreting and responding to these events and challenges differently, almost seeing different meaning in them. In his classic and pivotal work, The Problem of Generations, published in 1928, Mannheim argued that the generation a person was born into had the potential to shape their consciousness and perception of the world, much like one's class position does. People in the class will have different familiarity with another key thinker at this point, Karl Marx. Marx was an influential German thinker who passed away in 1883, just a decade before Karl Mannheim was born. Mannheim was therefore influenced by some of Marx's ideas, particularly the idea that life experiences shape ways of knowing. Marx argued that one's position in the economy as an owner of a factory and wealth, or as a worker who had to sell one's labor for an hourly wage, shaped how one thought about the world. That those life experiences were so different that they cultivated different perceptions of reality. Mannheim extended this idea with the idea of generation location, defined here as the potential for individuals who are born and reach maturity, so who are teenagers basically, in the same time and place, to be exposed to historical events that shape their consciousness in the same distinctive way. Mannheim isn't saying that every member of a generation will think the same way, but he is suggesting that if you were born in the same time period, in the same country, and happen to experience the same key historical events, especially when you are young, then you will probably see the world in similar ways as other people who were also born in that same time and place. Mannheim directly compares generation to class location. He writes, quote, that both generation and class endow the individuals sharing in them with a common location in the social and historic process, and thereby limit them to a specific range of potential experience, predisposing them for a certain characteristic mode of thought and experience. In other words, Mannheim is saying that generation location shapes the structural conditions we will likely encounter as young people, and as a result, how we think about and see the world. Let's look at an example of generation location by thinking about how age intersects with generation. Our question is, what does it mean to be 55 years old? And specifically, we are going to ask, what did it mean to be 55 years old in 1950 versus today? Think for a minute about how you could determine what it means to be 55. What are the different markers or forms of evidence that a social scientist could draw upon? One marker is dominant narratives of aging, prominent cultural ideas. You can access these dominant ideals in cultural texts like movies, cards, journals, the newspaper. Advertisements are a really big one in terms of who is being sold what products. You might also think about your own personal experiences, perhaps with your grandparents or great-grandparents. What were their lives like when they were 55 years old? How did they spend their time? What ambitions did they have? And how might that differ from your parents at 55 and other people you know who are 55 years old? In the 1950s, at least in a Canadian context, aging was portrayed as a period of decline and dependency on others for support. This included economic support and an increase in likelihood of poverty. And we'll look at data that supports this. It was also associated with illness, lower quality of life, and ultimately the end of life. If we look at life expectancy at birth by sex in Canada from 1920 all the way to 2011, we can see that in 1950, the average life expectancy was between 65 and about 70 years old. And there's a few years difference there for men and women. By 2011, this has shot way up to closer to 80 years life expectancy. Between 75 and 80 life expectancy for men on average, and between 80 and 85 for women. Depending on the time period you were born historically, being 55 might be extremely old or even closer to middle age. Let's look at this map from Our World in Data that offers average life expectancy at the national level over time. Starting from 1875, we will watch all the way to 2019. Notice the country's changing color. Average life expectancy is marked by these colors at the bottom. So gray means we don't have data for the country. Dark red means a life expectancy of around 30 years, all the way up to purple, which is a life expectancy of 85 years and above. Let's see what happens. So in 2019, depending on the country that you are living in, your average life expectancy will differ. So you might be living in a country with a 65-year life expectancy, 75-year life expectancy, 80-year or 85 years. Depending on that context, 55 might seem young or old. If we go all the way back to 1921, where we can see the majority of countries have a life expectancy close to 30 or 40 or 55 years, being 55 would actually be considered extremely old. So we know that what it means to be 55, whether that is seen as young or old, middle age or end of life, differs depending on the time period you are living in and the country that you are living in. But average life expectancy is not the only marker we can turn to understand what it means to be 55. We also need to consider the economic and health supports embedded in different countries. A great example of changing social supports for elders occurred in Canada between 1980 and 2009. In the late 1970s, the poverty rate for people 65 and over in Canada was around 30%, which was higher than the rest of the population. The percent of elders living in poverty reduced drastically by 2009, hovering at around 5%. How can we explain this change? In 2020, the Conference Board of Canada wrote, quote, "The pronounced decrease in Canada's elderly poverty rate has largely been attributed to the implementation of the Canada Pension Plan and Quebec Pension Plan in 1966. Pensions as a proportion of disposable income among Canada's elderly more than doubled between 1980 and 1996, from 21 to 46%. The first cohort to receive full public pensions turned 65 in 1976. The generation that followed became the first beneficiaries of private occupational pensions that were expanded between the 1950s and the 1970s. So what we see here is the impact of economic and social policy. The baby boomer generation, those born after World War II, roughly between 1946 and 1964, are currently between 56 and 74 years old. As a generation, the boomers have experienced numerous structural changes that have benefited their experience of aging. They've benefited from Canada's old age pension, which began in 1952, the Canadian Pension Plan from 1966, the Guaranteed Income Supplement payments beginning in 1967, and this generation was the first to have antibiotics and immunizations as children. They were also the first adults to access legal oral contraception, and they received universal healthcare coverage between 1946 and 1961. Canadian sociologist John Miles has compared the aging experiences of people who were elderly in the 1950s versus today. He writes that they had fundamentally different life experiences. that structured their opportunities and their perceptions of aging. Quote, the elderly cohorts of the 1950s were poor because they had poor lives. Born at the close of the 19th century, their youth was marred by World War I, and their working years straddled the Great Depression and World War II. They were poor not only because retirement plans were ungenerous and private plans underdeveloped, but also because they were unlucky generations. By comparison, today's retirees are relatively affluent, mainly because they had good lives. They are the children of high industrialism. Their early careers straddled the booming post-war decades. They generally enjoyed job security and rising real wages over most of their lives, and as a result, accumulated substantial savings and resources, not just Canada Pension Plan benefits. Compared to their parents, today's retirees, these children of high industrialism had, quote, good lives. So Miles is essentially saying what it means to be old differs depending on when and where you are living and what experiences you have had as a generation marked by pivotal collective events. So think about what it means to age today. What do you see in commercials, on television? Here are some examples. So on Netflix, we have more media geared toward older generations. Here you might have seen the show Grace and Frankie, with the very famous actors Lily Tomlin on the left and Jane Fonda on the right. These women are in their 70s and 80s, and the show features them creating new lives for themselves after their marriages end. Here we see Meryl Streep and Alec Baldwin, shown at the end of a sex scene in the movie It's Complicated. Do you know how old Meryl Streep is? She is 71. And there has even been the creation of an entire magazine called Zoomer Magazine. So what is a Zoomer? A Zoomer is, quote, a boomer with zip, people age 45 plus who enjoy life to the fullest. The world's largest and most affluent generation, the 45 plus. Open a newspaper, turn on a television, read a blog, it's likely you'll find yet another story about the enormous power and influence of the 45 plus population, the people who are literally reinventing aging. These are quotes from Zoomer Media Limited back in 2016. And let's look at the articles shown on the cover of this magazine. Stronger, longer. Find cancer faster. Walk your way to lasting brain health. Easy diet at fitness hacks. More money. Hair today. Better with age. Explore Asia from the ancient to the emerging. What dominant narratives about aging are being communicated on this magazine? If we go back to the 1950s and compare the dominant narratives of aging, what are today's dominant narratives? Existing text analyses indicate that dominant media emphasize the importance of an active lifestyle, the value of new experiences and freedom, particularly through travel, maintaining youthfulness, an indication that elders today have a bit more agency with regard to finances. Now, on the one hand, this could be from generational wealth, or this could be from state-structured programs like pension plans that were not yet implemented for people that were old in the 1950s. There's also an emphasis on medical interventions and constant self-regulation to fight anticipated decline. What examples of dominant aging narratives can you find? You might find them from different places around the world, as the ones I've presented here are largely North American. So what we see through this example is that age itself is culturally and structurally created. To be 55 in 1950 is a different thing than being 55 in 2020. And this brings us back to Mannheim's generation location. The idea that generation location shapes the structural conditions we will likely encounter, and therefore how we think about the world. In this case, how we think about aging and how we organize our lives, what we believe is possible. But let's think critically about this idea of the Zoomer generation. Who is this idealized model of aging accessible to? There's certainly class differences between today's elders. The Zoomer lifestyle costs a lot of money to pay for new experiences and health maintenance and so on. This access is also racialized. Here we can see Canada's average life expectancy broken down by male and female. The blue striped line is the average life expectancy for the total population of Canada. For all men in Canada, this is 79 on average, and for all women in Canada, it is 83 on average. However, if we break this down by Indigenous status, so First Nations is the dark blue, Métis is the turquoise, and Inuit is the white, we can see that Indigenous populations have a lower life expectancy. What factors can we tie this to? To explain these differences, we would have to consider systemic racism, discrimination, intergenerational trauma, access to resources, and colonialism. We can also think about urban and rural differences. So Métis Indigenous people are descendants of unions between Indigenous and European people, and they are more likely to live off reserve in urban centers, whereas First Nations and Inuit are likely to live more remotely. So to conclude, we can ask about the utility of the concept of generation. While it unites groups of people who are born at a similar time period and experience similar structural conditions, the analytical category of generation can also conceal differences and inequalities between members of the same generation. Is Zoomer an elitist media construct designed to make money from the wealthiest elders, yet a lifestyle that is not accessible to the masses? Or is it a concrete outcome of changing economic conditions, healthcare access, and a growing social safety net? A key takeaway point here is that conceptions of age and aging not only shift with generation, but that these generational experiences intersect with race, ethnicity, immigration, colonialism, gender, class, ability, and so on. In this short mini lecture, we have gone deeper into the sociological imagination to consider Mill's argument that individual biographies intersect with societal history. As this lecture ends, consider how your own individual biography is intersecting with the time period you were born in. What generation are you part of, and what are the unique structural conditions that you face?